So now we come to the next distinguished speech by Guy. I think he is a very multi-talented person. He has been doing design, doing project management, doing development, and he found his own firm, and he worked all over the world, from the States to Europe to Hong Kong. And he is now taking care of a big team under one of the largest consultancy in the world to do something called Smart and Healthy City. And in particular, because he is now working in Hong Kong, so his speech, I think, will touch upon high-density development as well. So we look forward to Guy.
Good morning. This is a subject that's very dear to me. I used to present primarily on issues of urban design and urban planning and climate change. And I had an audience of about 150 public servants in Central Europe 4 years ago. And I asked them, I actually had a slide up with the first tornado ever recorded in Poland. I had a slide up on the wall at the time. And I asked them, how many of you believe climate change is real? And actually 3 of them raised their hand out of about 150 people. So I realized this was probably not the main theme for the audience. But I was also beginning to address the issue of health. And I asked them, how many of you are concerned with the health trends in your electorate? And there, about 80% of the audience raised their hands. So I began to see more and more a bridge between these two issues. So I'm going to take you through, well, first I'll introduce a little bit about AECOM. I guess many of you are familiar, especially here in Hong Kong. Hong Kong is actually our largest office. We have 4,600 employees in Hong Kong, and 5 projects in Hong Kong alone, larger than anything that's under construction in the United States. But globally, we are present in 150 countries, about 100,000 employees. I'm going to start off by just touching on some statistics on cities that are often considered model cities for the developing world, which is where most of the growth is going on these days. This is Dubai. And just some interesting statistics about Dubai. Now, there's a color code. Red numbers are not good, yellow numbers are mediocre, and eventually we'll see some green numbers when we run through some cities. But the interesting thing about Dubai is that it is, when you're in Central Europe, you're in Brazil, you're in Africa, you're in actually parts of Asia, people see this as the model of the future. That's the future. You know, Dubai, wow, it's progressive, etc. Well, Dubai comes with a lot of strings attached, notably enormous CO2 output. Traffic deaths are among the highest in the world. You have obesity rates of 33%, overweight rates of 67%. We're actually a little bit worse than the US. We'll see that in a moment. Walkability index is one of the lowest. That's the little gentleman there walking. And the average height of buildings now under construction in Dubai. The interesting thing about this is, as I said, this is kind of seen as a model of how cities should be developing by many investors. I don't say the public sector sees it this way, but investors certainly see it this way. Now, another poster child, Atlanta, could be pretty much any city in the United States, also has similar challenges. Our obesity rate is even higher in the United States and in cities in the US, and as was indicated before, much of that is occurring in the suburbs, but it happens in cities, in the core cities as well. Often you're in what we call food deserts in cities, and there are various issues around that. I'm not going to dive into all of that, but there's another aspect of this. It's the average height of the building, as opposed to Dubai, is actually less than 2 levels in cities like Atlanta. And we have places like London where things get a little bit more optimistic. But even in London, there are big differences between different neighborhoods in London. You can expect to live 90 years in South Kensington, and you can expect to go 4 or 5 tube stations away, and you can be expecting to live 70, 72 years. So there are enormous differences within the fabric of that city. Beijing, interesting case. Just as a kind of summary statistic, by the end of this year, it's estimated that 50% of the Chinese population will be overweight, which is pretty amazing given that in the 80s, pretty much everyone was on a bicycle and everyone was very fit. The first time I went to China was in 1986, the mainland. and everyone was on a bike. Now that's all changed. As soon as you get a car, apparently the statistic is that your chance of being obese within 2 years increases by 50%. There's a whole lifestyle that goes with that, of course. Now, much more optimistic. Places like Barcelona. I had the fortune to live back in the 1980s in Barcelona, and so a lot of my urban design, urban planning habits come from Barcelona. But Barcelona is quite an interesting case. Spain in general, but especially the cities in Spain, Madrid and Barcelona. You see the statistic on obesity. We're looking at 7.7%. That's actually for Catalonia. The city of Barcelona is less than 5%, which is better than Hong Kong, by the way. The walkability score, this is basically the gold standard of walkability. It is a city that is a place that it draws you into the city. It makes you get out, makes you want to be active. As was said before, one of the key issues is that people are becoming more and more sedentary. Now, Hong Kong does pretty well. I'm not sure in terms of the longevity statistics if it actually includes a lot of the people who are here just working temporarily. But in any case, the numbers are pretty good. But there is a concern. So you see there's a red number in terms of the height of the buildings. And I'll come back to that in a moment. Tokyo, I'll just use a case because here we'll see the difference in Asia versus the West in terms of the progress of health and longevity. So back in 1960, the average Japanese person lived 67 years versus 69.8 in the US and 71.1 in the UK. By 1970, they were living 72 years, so they'd surpassed the US. The US had progressed minimally. In the UK, they'd lined up with the UK. Now, part of that, I will come back to some of these things in a moment, is the way people are living in that city. Today, we're at 84.5 years, so for a country, it's actually the highest life expectancy. Hong Kong is a very urban environment. I think if we took Tokyo proper, we'd probably end up with a longevity higher than Hong Kong. CO2, of course, is higher. But what's very interesting is the average height of buildings in Tokyo. It's actually less than 3 levels. So very, very different urban typology than what we're seeing in places like Hong Kong. And I'll come back to some of these things. Now, I'll just, again, the obesity rate is 3.5%, which is about a third of what Hong Kong's is. Now, the interesting thing is by 2050, the life expectancy in Japan is to be 92 years. I'll just touch on one thing. I don't know how many of you know what the Metabo law is. Since you are a health specialist, you probably know. It's a penalty imposed on Japanese companies when over a certain percentage of the workforce has a waist circumference of over 33.5 inches. So, and it is in the millions of dollars, the penalties. So depending on how many employees you have and to what degree. But they can only pull off something like that if people are basically living healthy lives. Now, the diet is a key factor there, but the walkability of Tokyo, and this I'll just come back a couple slides, is unique. This would be an entirely illegal scenario in Hong Kong. Now, it happens in places like Mongkok, but the cars are not actually allowed to drive through. Here, this is the epitome of what we call a shared street. In other words, the majority of the streets in Tokyo are streets that are not just for vehicles, but they're for just about anything. Vehicles, bicycles, pedestrians, etc. There's a very fine grain to the city that remains at human scale, though it is a metropolitan area of over 30 million people now. So, now I want to touch on a couple of cases. I was working quite a bit in Central Europe, in the most rapidly developing parts of Central Europe, like Poland. These, I'll just show 2 cases of development during roughly a 10-year period outside of Warsaw. Because the biggest challenge in terms of creating healthy environments, I believe, is actually on the urban fringe, is how are we expanding cities? Are we expanding them in a way that are going to promote people to have healthy lives day in, day out? Or are we setting ourselves up to have very difficult challenges in the future? So on the top is business as usual. 2002, an empty site, basically rural. 2011, the type of development that's going on all over Central Europe today. Incremental pieces of gated communities, basically, as well as shopping centers, generally malled shopping centers, and the use profile of the land. So up on the top, you see the typical expansion of a Central European city. But it actually can be carried to most of Europe. On the bottom, this is a project that I oversaw over the last 14 years, which was also an agricultural area, but we developed it with actually about the same number of different developers, but we did it in a very dense and integrated way. And these are the differences in terms of the urban spaces. The zoning guidelines were about the same in the two areas. On the top is business as usual, on the bottom is what we created. And these are, by the way, on the street on the right are probably represented 6 or 7 different developers. But we actually integrated their different development approaches to create something that was coherent. One of the things we look at is we look at the profile of a daily lifestyle scenario for people of different age groups. So we look at children, we look at teenagers, we look at adults, we look at seniors, and we actually try to address how active can these people actually be in these environments. And what we found in the business as usual is that it was actually very, very difficult. And that was what was driving these statistics that we saw of, in the case of Poland, over 25% obesity at present, in a country that, of course, was less than 10%, even less than 5% during communist times only 25 years ago. And in a sense, if you will, the analogy is, if you create a city which has a dense and interconnected texture, it's a bit like the fiber of our own bodies. On the top, you have unhealthy fat cells. On the bottom, you have healthy fat cells. You simply create, by the typical development pattern of cities in Central Europe, you create an environment where you simply cannot connect the points by bicycle, on foot, or even public transportation. Can't actually connect all of those places together. If you live in the block that's on the slide on the top left, the image on the top left, you have a store in red, which is just below that big block of white housing. If you live 50 meters from that shop, you actually have to go 4 kilometers to get there, the way in which the city is organized, because nothing has been integrated. So just some more details on that community that's been built. It's built out, even though it looks very homogeneous, it's actually done by, as I said, many different developers from all over the world. This is a typical section. We achieved a density of about 10,000 people per square kilometer. If you look at the overall density of Hong Kong, it's around 3,500, and you have areas that are extremely dense, but you also have a lot of very open areas. So we achieved about 10,000 per square kilometer, which is about 3 times the average density of Chinese cities today. But we never went over 5 floors. We created courtyard buildings, which is a tradition in Europe, European cities. And within each of the courtyards, we actually kept them green. I remembered from living in Barcelona what happened to the blocks, the manzanas of the Ensanche. They were filled up with industry. The parks that were originally designed disappeared. Here we actually made it so those parks actually had to stay, and we have playgrounds within each one. But a very human scale. The other thing is we actually, since there's not a big tradition or there's no funding in Central Europe to be able to do landscaping and developers, once they've sold a unit, we actually mobilized the residents to do their planting of the public space themselves. We got them out. And one of the interesting things about that is it really meant it was their space. Now, it was based on plans that were approved, et cetera. The community is extremely active. It has one of the busiest borrowed or kind of shared cycling stations in the city. In fact, there's so many bikes here, there are not enough places to put them. Marathons run through it, all kinds of programs for kids, and playgrounds actually within 70 meters of any resident's home. And then some of the other infrastructure, whether it's the City Hall, one of the premier hospitals in Poland on the bottom right, buildings, of course, LEED-rated buildings. This is the premier German school on the upper right. All of those are integrated into the community. So it's not a dormitory community, it's an absolutely integrated place where you could theoretically work and live in the same community. And just some of the other details of that and the texture of that society and the typical roofs and some of the areas that are still underway to focus more on teenagers. Now, there's some of the overviews. And all of these were done, by the way, all buildings were done by Polish architects, which is a part of the whole sustainability approach, but always done based on this metric of certain heights, certain qualities of materials, courtyards that were private, but courtyards always oriented towards children, and then certain parks that would actually run through that would connect the community. So this red line that you see is actually a rubberized jogging path, which has almost a traffic jam in the evenings. People are all out there running. So it's not just looking at the kids being active, but also the parents. And just some of the green spaces that are within it, and the events that actually go on. Now, this was anathema to most of the developers. They were thinking, oh my gosh, we're going to have thousands of people visiting for certain events. This is a beatification. The Pope will come here, I think, at the end of this year as well. This was a couple of years ago. 20,000 people came. They marched from the center of Warsaw all the way to the site. But it was part of creating a real community. So it was something that was, from the outset, intended to be integrated and complex, which, as I mentioned before, was very difficult for a lot of developers. But probably the biggest asset in being able to create this, and my work here was not just design, but it was also as development, was we were working with a landowner who knew nothing about real estate development. So we were able to, in addition to achieve the kind of returns that you want to achieve, in this case we were between 15 and 27% returns. My favorites are the statistics that came out of this community. We have the longest life expectancy in Warsaw now. We have about 35,000 residents. And so we have now the data versus the other areas. And actually the life expectancy now in 2014, as the latest data, is actually 90 years. So it's similar to the best districts of London. We have the lowest childhood obesity rate and also the lowest neoplasm rate in the city. What's interesting is we have the highest birth rate in Poland. We're about double the national birth rate. But the interesting aspect of this is that we also have the best educated women statistically in Poland. And usually those two things don't go together. So there's something about the environment that made people more optimistic about their future. Now, population growth is not something you seek in most of Asia. But in places like Poland and much of Europe, it's a real issue today. We have declining populations. We have the lowest crime rate, even though, as you noticed, it's not a gated community. So we actually have a lower crime rate than the gated communities in Warsaw. Because as everyone probably knows, a gated community has low crime for about 2 years, and then the pizza delivery guy starts to give codes out, and your crime rate actually evens out. And within gated communities, you can have higher crime and actually more severe crime than you have in a neighborhood if it's well designed. And the other interesting aspect was to test civic engagement, because this is also part of well-being. We actually had a record voter turnout the last 3 elections in Poland. So we set a record for the country in terms of people actually participating in elections. So here's that statistic regarding the birth rate. So there's a well-educated woman, probably with over 2 children, because that's the statistic in the neighborhood. Now I'm actually going to shift to South America with another project which is actually under construction. This diagram on the left is the sedentary trend. This is not an unusual diagram in the modern world. China has a similar diagram, but since I want this to be a project-focused presentation, basically people are moving less and less. And often people focus on diet as a reason for obesity or diabetes, hypertension, et cetera. It is just as much about how much we move. And this is the curve for Brazil. And interestingly enough, the obesity increase, we've only seen that kind of increase over the last 10 years in places like the Middle East. Not even the US was at 1% per year more obese population. And Brazil has achieved that. Now, these are a couple of sites outside of one of the capital cities of Brazil. This is Aracaju. This is in the northeast of Brazil. One of the largest developers in Brazil is Alphaville. They were our neighbors. The project we developed is called Brisa da Atalaia. This is the waterfront at the Brisa da Atalaia site. So we have a kind of interesting comparison between business as usual, successful business as usual, and what we were trying to do that was different. So you see Alphaville on the left side. You see the Brisa Dama project on the right. And Alphaville, they've actually created a wall between the waterfront, between the beach, and the community. The reason they do that as developers is they don't want to shift the value curve for people to want to buy near the sea. So that way everything is neutralized. But to get to the water, you actually need to drive a car now, even if you're living 200 meters from the waterfront. Now what we did is we took the opposite. We made several points of entry directly from the water, and we actually created an entry gate, and we allowed the public to actually come through the site, which is very controversial in Brazil because there are a lot of gaps, economic gaps and certain rates of crime. But we believed it was better to engage the community rather than to segregate our project in the traditional way. The other thing is that you see the lakes that exist on our site. Well, those lakes didn't just stop on the Alphaville site. They were also there. Alphaville, with its political clout, was able to basically erase the lakes as if they didn't exist, and they basically built over all of those areas. But the problem is you completely change the climate of the site when you do that. This site, you don't even need air conditioning because there's a constant breeze. It's a very, very comfortable site. But today, if you go onto the Alphaville site, there is no breeze because you have a 4-meter wall around the entire site. And the buildings are all cheek to jowl. And nothing has been designed, in a sense, to incorporate that breeze into the fabric. And so here's actually under construction a few years ago, the two sites in parallel. On the top is our site, where we actually kept as many of the trees as possible and said that when you build, you can remove the trees, but you need to keep at least 50%. And now palm and coconut palms are easy to transplant, so you can actually move them, and about 80% of them will survive. So there's that wall I was talking about. There's the sign to the beach. So your beach view disappears, but again, it's in the interest of the economics of the overall site. I'm sorry, the colors changed, but we did the same analysis in terms of how walkable, how can this place promote health versus discourage health. And the profile, the thinner profile, obviously, is one that allows you to be more active, to be healthier on a daily basis. The thicker profile is, unfortunately, business as usual in Brazil. And these gated communities like Alphaville are prominent throughout the country today. Just some of the images of the project. Brisa da Atalaia. There's our beach, there's our entry, our common area, and the sports facilities, and also the way in which we engage the wetlands. The clubhouse, which you'll notice is actually outdoors. 70% of the clubhouse facility is outdoors because we don't need to be indoors if we design our buildings right. And this is actually quite important because if you get used to being outdoors in a climate where the breeze is good and everything, you use the outdoors. The typical developments in Brazil, they have a lot of sports facilities, but no one uses them because they're in their air-conditioned boxes. They walk outside, and the thermal shock means they simply think twice or 3 times and basically just give up and they go back inside, and they get back online. Some of the other sports facilities, all incorporated and actually spread through the community along the main road. And then hotel, there's actually a medical clinic. This is for Müller-Wolfert. He takes care of the Bayern Munich football team. A school, which is incorporated, again, at walkable distance for the residents to take their children. A lap pool, which is one of several. And then the different housing types, to actually integrate housing so that different income groups, as well as different generations, can live in the same environment. One of the key issues about elderly is not to design housing for elderly. Is to allow elderly to be incorporated into society on a daily basis. That's actually what they want more than anything else. And so one of the things that we try to do is incorporate that from the outset in any community we build. And also when your children grow up, they don't actually have to move out of the neighborhood. They can actually be in the neighborhood, but in a different part. And just some of the other, the residential units are also designed to be indoor-outdoor. So certain areas are air-conditioned or can be air-conditioned, but many areas are outdoors. Again, taking advantage of the climate and the breeze. And just some of that under construction now. That's the pool of the clubhouse and the open clubhouse. And just very quickly, some things that we're doing here in Hong Kong. This is, of course, all of you know this about metabolic equivalent of task, but one of the things we're trying to do is calculate typical day and week and lifestyle scenarios for people in projects that we're working on. So one of the things we're looking at is the Anderson Road Quarry, which is a site not so far from here. It's kind of above Kai Tak. And we look at how different age groups will actually use that community and how, trying to understand their life pattern, we can shape certain decisions about the physical environment. So in the case of small children, there was a plan for a lake, and of course the lake was just a visual feature in the original plan. And what we realized is that within this high-rise environment, there's a real issue about how the kids are going to get enough activity. And a child should walk about 12,000 steps a day. It's really hard to do that in a high-rise environment in Hong Kong. So what we're going to do is actually, in that case, we remove the lake, or we will have the lake, but it'll actually be a lake for swimming, and it'll be redimensioned so that we can actually have a green space as well for those kids to run around. The other thing we look at is how do we treat guidelines for developers. Do we require parks to be at the mid-level of a building or on the top of a building in addition? So I'll just run through very quickly. Teenagers, lifestyles, adults, and we do the calculation based on their coming off the site as well, especially for adults, adults with children, middle age, and senior. And we know pretty much how many calories people consume in Hong Kong, so we can match up this data. Then the overall plan, how we integrate certain activities within the site to help establish a more balanced lifestyle. The other thing is within the units themselves. This is a project, this is actually in Europe that we did, but we look more and more at creating units on 2 levels so that people get exercise by just moving around. And this is also learning from places like Tokyo, where most of the vertical movement in Tokyo is by stairs because it's 2 or 3 floors. It's not 20 floors, it's not 118 floors. Even if it's a more budget unit, the same thing. And just very quickly, this is some of the work of my Hong Kong University students, urban design students, their thesis. But just the kind of things they're addressing now, making modern neighborhoods in Dhaka more walkable. Today, no one walks in modern Dhaka. Everyone walks in the old part. How can we learn? How do we make those more walkable? Or here on the bottom right, which I'll show in a little more detail, is how do we make the high-rise, the Hong Kong high-rise, a healthier place? And in this case, it was a student was looking at having 1 elevator stop every 3 floors. Of course, there's a service elevator that goes to every floor. But then creating a kind of social place, a meeting place at that elevator stop. Sometimes it would be sports, sometimes it would be more cultural, sometimes it would just be a place where you'd play games. And also looking at a modular system that would allow those units to evolve over time. So you don't have to move out of the building when you change your income up or down or when the children move out, et cetera. So just to come back actually to one of the things that Professor Kapran had indicated, for me it is absolutely interconnected. Climate change, people's well-being, and our physical environment. We have to see all 3 of those things absolutely as one. And the beauty is that since we have a tough time looking down the horizon, let's say most of us have a tough time looking 20, 30 years down the horizon with climate change, but all of us have someone in our family or ourselves who are struggling with certain physical problems, certain NCDs, non-communicable diseases that have become so prominent in the last decades. And we can see that and we can act upon that. But the beauty is acting upon our own well-being allows us to act upon the environment and stabilizing the environment most effectively. So I guess my main message is if we come back to the human metrics, if we really start to look at things in terms of distances, walkability, integration of uses, many of the values that make most of our favorite cities, the cities we go to when we have time to just visit, spare time, if we actually incorporate those things effectively into what we're doing today. And that's the challenge, because what we're doing today is actually getting worse in many cases, not better. If we look at Chinese cities, we have the best chance at not only making ourselves healthier, but stabilizing our planet. Thank you.